Good evening, everybody. I'm Dr. Sudarshan from Hospital Vijayawada. Today, we are here to discuss about hypertension and its management. So, before going into the topic proper, we all are aware about the problem that is hypertension, which the world is facing now. Because every one individual and three individuals is having hypertension. But the hardest fact is that only 1/3 of them are getting a proper treatment, and even half of them are being diagnosed with hypertension. So before going into the treatment and all that, first we should make a diagnosis of hypertension in a proper way. So this hypertension diagnosis should be done by a simple method, that is BP recording. You can get it done with your doctor whenever you consult your doctor. So that's the most common thing that should be practiced by every individual. So before going into the topic proper, I would like to emphasize the importance of proper ways of measuring this BP. So you have to be relaxed. So you have to be relaxed at least for 5 to 10 minutes before getting your blood pressure measured, because whenever you are in a tensed position, there is every chance that your BP measurements may go high. So we should always try to avoid that. Try to be as relaxed as possible. Sit in a comfortable chair, lean down. So lean your back so that you would be comfortable, and make yourself comfortable. And after 5 minutes of staying in that position, get your blood pressure measured. So this will help doctor find the correct measurement of your blood pressure. Not only that, you should always try to insist about the cuff size by which your doctor is measuring, because a too small size cuff is one reason behind a falsely elevated blood pressure. Because if you use a small cuff for a fatty individual, here their blood pressure would be falsely elevated. So you have to insist on a proper size cuff. So that is always important. So insist for the proper size cuff, so that that cuff at least rounds your arm by at least 2/3. After that, you should remember that your arm should be at the level of your heart, because if you elevate your arm or if you lower your arm, not only the arm, your blood pressure reading instrument also should be at the level of your heart, so that if that blood pressure measuring instrument is a bit higher or a bit lower, that may falsely impact on your blood pressure readings. So you should take care that your arm and your blood pressure taking instrument should be at the level of heart. Otherwise, false readings are always possible. And not only that, you should make yourself comfortable. Make sure that your legs are not crossed. That means you should be relaxed and make your legs uncrossed, because if you cross your legs and get your blood pressure checked, that may falsely elevate your blood pressure reading. So all these things should be avoided while getting blood pressure getting measured. Not only that, in a way, you should make your self comfortable. I mean, you should make yourself comfortable even a full bladder. That means if you are having an urge to urinate, that may also falsely elevate the blood pressure reading. So you have to make yourself comfortable in every possible way, so that you will have proper blood pressure measurements. So after getting proper blood pressure measurement, you should try to insist your doctor for at least having 2 or 3 readings, because one reading may not be correct. So you have to take average of 2 or 3 readings. If the average of those 3 readings is higher than whatever that is prescribed, then you are labeled as hypertensive individual. So after that, you should make every attempt to get your blood pressure. First, starting with lifestyle modification. If that lifestyle modification, including the diet and exercise, is not able to get your blood pressure under control, you have to go for medication with your doctor's advice. Thank you.